Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to deal about endocervical curettage. So as in the previous module, we discussed about the pap smear, which is a screening test for cancer cervix. Followed by pap smear, we discussed about the colposcopy, which is a diagnostic test for the pap smear. Now we are going to discuss about the endocervical curettage. So before discussing about endocervical curettage, let's have a quick rapid review of whatever we have discussed before, right? It's going to be a very quick session. Okay, so as you can see here, we all know that the cervix is actually divided into two parts, right? One is the exo or the ectocervix, and the second is the endocervix, right? The visible portion of the cervix is the exo or the ectocervix, and the invisible portion of the cervix is the endocervix. So what do I mean by visible and invisible portion of the cervix? I mean that if a doctor or a physician is going to put a speculum and examine in a female, through the speculum examination, the part of the cervix that is visible is the exo or the endocervix, and the part which we can't see when we do the per speculum examination in the said female is the endocervix. Is that clear? So as you can see here, this is the ideal image which you will get when you do the per speculum examination. So this pinkish portion of the cervix is the exo or the ectocervix, and this part is going to be the transformation zone. As we all know, transformation zone is that area of the cervix between the old and the new spermocolumnar junction, right? That is the transformation zone where the squamous metaplasia is going to happen. Is that clear? Yes. Now, as you can see in this image, you can see the pinkish epithelium here, and that is the exo or the ectocervix, and this is going to be the transformation zone, and you can visualize the external os as well. This is the external os. So endocervix is actually that part of the cervix which is situated proximal to the external os. What do you mean by proximal to the external os? So endocervix is actually proximal to the external os. Proximal is also known as above. Right? Above the external os, the endocervix is present. So as you can see in this image, the cavity of the cervix is also termed as the endocervical canal. The cavity of the cervix is also called as the endocervical canal. And this endocervical canal is nothing but the endocervix, right? So this endocervix also has specific functions, such as it will help in the passage of the menstrual blood when a female is going to menstruate every month, and it is also going to help in the ascent of the sperm during any act of coitus in a female, right? And it also has specified structures and enzymes present in the cervix, right? So this is all particular about the exo and the endocervix. Is that clear? Okay. So coming back to the discussion, so colposcopy, so we all know that colposcopy was a diagnostic test, and with the help of the colposcopy, you're going to take biopsy from any abnormally looking cervix, any thick, friable, indurated cervix, any mass, and from abnormal blood vessel using the green filter in the colposcopy. So basically, colposcopy can visualize only the exo or the ectocervix. Right? So therefore, with the help of colposcopy, you can take the sample from only the exo or the ectocervix. But if that is necessary for me to take the sample from the endocervix, what will I have to do? Can I take the sample from the endocervix with the help of the colposcopy? No, because we all know that colposcopy is a magnifying instrument. With the help of this magnifying instrument, you're going to just take the biopsy from the visible portion of the cervix. But this endocervix is the invisible portion of the cervix, that it is situated proximal to the external os. So in order to go even more deeper, you can't take colposcopy. For that purpose, we are going to take a test, and that is called as the endocervical curettage. What do you mean by endocervical? The part of the cervix from where we are going to take the sample is the endocervix. Therefore, it is endocervical. Curettage means you are going to scrap whatever tissue is going to be present in the endocervix. So, since you are going to scrap whatever tissue which has been present in the endocervix, it is called as endocervical curettage. Now, you may have the doubt that why are you going to take sample from the endocervix, right? So, as we all know, exocervix is the part of the cervix which is lined by the stratified squamous epithelium, the pinkish kind of epithelium. But endocervix is lined by the columnar epithelium, right? It is going to be bright red in color, and it is lined by the columnar epithelium. And we also know that the most common type of cervical cancer is the squamous cell carcinoma, right? But the second most common cancer to occur in the cervix is the adenocarcinoma. So what is adenocarcinoma? The cancer which is arising from the columnar type of epithelium is the adenocarcinoma. And we all know that the columnar type of cells are present only in the endocervix, right? So because if adenocarcinoma is going to occur in the cervix, then definitely it has to occur only in the endocervix, because the columnar type of cells are present only in the endocervix. Therefore, in order to rule out adenocarcinoma, you have to take sample from the endocervix, right? So this endocervical curettage in itself has specific indications which we'll be discussing later in this module, right? Okay, so now we have discussed about the base. Now we have laid the base. Now we are going to build up the further concepts. So as I have told in the previous module, transformation zone is the area of the cervix which is situated between the old spermocolumnar junction and the new spermocolumnar junction. Cancer cervix occurs most commonly in this transformation zone. And the most common type of cancer to occur in the cervix is the squamous cell carcinoma. Second most common cancer to occur in the cervix is the adenocarcinoma. Is it clear? So transformation zone is the most common site of site of cancer cervix. Is that clear? Yes. So transformation zone is the most common site of cancer cervix. So in transformation zone we have three types: type 1, type 2 and type 3. So let's discuss about that. Type 1 transformation zone is where the transformation zone is entirely visible, right? The transformation zone is entirely visible, and this transformation zone is present in the exocervix only. Type 2 is where the transformation zone is again entirely visible, but it has an endocervical component along with the ectocervical component. Is that clear? Type 1 and type 2, the transformation zone is entirely visible, right? Type 1 is the transformation zone is present only in the exocervix, but in type 2, it has an endocervical component in addition to the exocervix. Type 3 is where the transformation zone is not entirely visible. The transformation zone is not entirely visible because it extends into the endocervical canal. So what is the endocervical canal? Endocervical canal is the endocervix, right? So the transformation zone is not entirely visible and it extends further into the endocervical canal. So we have three types of transformation zone: type 1, type 2 and type 3. In type 1 and type 2, you can visualize the transformation zone completely. In type 1, it is going to be situated in the exocervix only, but in type 2, it is going to have an endocervical component as well. But in type 3, since it extends inside the endocervical canal, the transformation zone is not fully visible. Is that clear? So it is type 1, type 2 and type 3 transformation zone. Is that clear? Yes. So now while discussing about the endocervical curettage, I told you in order to take samples from the endocervix with respect to certain indications, this procedure is called as endocervical curettage, where you're going to introduce an endocervical curette and you're going to scrap whatever tissue which has been present in the endocervix and send it for histopathological examination, right? So this is the procedure of endocervix. With the help of what? With the help of endocervical curette, or you can also use an endocervical brush as well. So we can use an endocervical curette or an endocervical brush as well, right? Okay, so now you may have the doubt, why am I going to take the sample from the endocervix? So as I have told you earlier, that in order to rule out adenocarcinoma in the cervix, which is the second most common type of cancer to occur in the cervix, you are going to take the sample from the endocervix with the help of the procedure endocervical curettage. So therefore, the first indication is going to be any lesion in the endocervix, right? Any lesions in the endocervix or lesions which are extending into the cervical canal, right? So because of that reason, you're going to take the sample from the endocervix. Columnar cells, adenocarcinoma. Squamous cells, As the name suggests, it is squamous cell carcinoma. Is that clear? Okay. So the first indication of endocervical curettage was any lesions in the endocervix or any lesion which is extending inside the endocervical canal. And the second indication is where when the transformation zone is not entirely visible. And we all know that the transformation zone is going to be not entirely visible in type 3 of the transformation zone. So type 1 and type 2, the transformation zone is entirely visible, but in type 3 only, the transformation zone is not entirely visible because it extends further inside the endocervical canal, right? Okay. And the third indication is staging of there is a mistake here. Staging of endometrial cancer. So in cases of staging of endometrial cancer also, you are going to take the samples from the endocervix. This is because below the uterus we have the cervix, right? So proximally we have the uterus, and immediately below the uterus we have the endocervix or the endocervical canal. Below that we have the external, or following that we have the exocervix, right? So the most earlier part of the cervix to get spread or metastasis from the endometrium is the endocervix. So because of that reason, whether to rule out metastasis has occurred to the endocervix or not, in cases of endometrial cancer, you have to do endocervical curettage to rule out metastasis. So in order to stage the endometrial cancer, if it has any cervical involvement or not, you're going to do endocervical curettage. And the fourth indication is where the transformation zone is entirely visible, but still there is no lesions. So a female with specific Z compliance, but when you examine, the transformation zone is visible entirely, but there are no lesions. So since there are no lesions, you're not going to leave the patient as such. You have to do the endocervical curettage to rule out any pre-existing cancer, right? Okay. And then, as we all know, pap smear report comes as atypical squamous cells of unknown significance, atypical glandular cells of unknown significance. So in that also, in specific reports, you have to do this endocervical curettage. And those are atypical glandular cells of unknown significance. So what do you mean by glandular cells? Glandular cells are nothing but the columnar cells. And we all know the columnar type of epithelium is situated only in the endocervix. Therefore, if the report of pap smear comes to be atypical glandular cells of unknown significance, which is a screening test, you have to do endocervical curettage. Endocervical curettage to rule out adenocarcinoma being present in the endocervix, right? Okay, so along with colposcopy, you have to do endocervical curettage. See, pap smear is a screening test. With the reports of pap smear, you can't proceed with any treatment. So following the pap smear, you're going to do the diagnostic test, that is the colposcopy. We all know that colposcopy can take samples only from the exocervix. But if the report of pap smear is atypical glandular cells of unknown significance, so along with the colposcopy, now I have to do the endocervical curettage to rule out the adenocarcinoma being present in the endocervix. And any cases, please remember, if the report of pap smear comes to be high grade squamous intraepithelial lesion, which is also called as HSIL, you have to do endocervical curettage. This is a definite indication where if you get high grade squamous intraepithelial lesion, you have to do endocervical curettage to rule out any adenocarcinoma being present in the endocervix. So high-grade squamous intraepithelial lesion, which is HSIL, and also atypical squamous cells where HSIL cannot be ruled out. See, those are atypical squamous cells, but HSIL cannot be ruled out. So the possibility is 50-50. So again, where HSIL is present, I have to follow with the endocervical curettage. Is that clear? So wherever I see HSIL, I have to follow it with endocervical curettage. So is the indications very clear for you? Please take a complete notes of this. This is going to be very helpful. If at all you are an university student, right, you can write whatever I have mentioned in this module. You can write it in your paper, right? This is going to give you even more additional marks for explaining everything in detail. Okay? Right. So the image which you see here, this is the endocervical curettage. So with this part only, you are going to scrap or curate the whatever tissue which is present in the endocervix. Now, you may have a doubt that you told me that colposcopy is not contraindicated in pregnant females because with the help of colposcopy, you are going to take biopsy only from the exocervix. But endocervical curettage is contraindicated in pregnant women. Please note that. Endocervical curettage is contraindicated in pregnant female. We'll discuss why it is contraindicated in pregnant female in the following discussion. So this image which you see here is the endocervical curettage. Endocervical curette. So what is the actual procedure of endocervical curettage? You're going to introduce this endocervical curette, right? And you have to introduce it inside the external os about 1 to 2 centimeter into the cervical canal. So proximal to the external os 1 to 2 centimeter into the endocervical canal, you have to introduce this curette, and with the help of the curette, you're going to scrap whatever tissue which has been present in the endocervix, and you're going to send it for histopathological examination. Now you have finally sent the report for histopathological examination. Now the report is going to come from a histopathologist, right? Okay, so now since the type of epithelium which is present in the endocervix is the columnar type of cells, therefore the report has to be, or the report may be negative or it might be positive, and if it is going to be positive, it will come like adenocarcinoma, right? So let's say for example the report comes as adenocarcinoma in situ. It is not invasive, but it is in situ. The report comes as adenocarcinoma in situ. Now what are you going to do next? If the report is going to come as adenocarcinoma in situ, next step is that you have to check whether any invasive cancer is present, whether the cancer is limited to that part of the cervix or it is invasive in nature. So in order to rule out invasive cancer, you have to do a cone biopsy. As we all know, this is a cone, right? So this cone is going to include both the exocervix, endocervix and the transformation zone. So all the three parts of the cervix, exo, endo and the transformation zone, you are going to take the sample with the help of the cone biopsy. So once you do this cone biopsy, you will get to know two things: whether it is an invasive carcinoma or it is a non-invasive carcinoma. If it is going to be an invasive carcinoma, what are you going to do? And if it is going to be a non-invasive carcinoma, what are you going to do? If it is an invasive carcinoma, you have to do hysterectomy in that patient. You have to do radical hysterectomy in the patient, where you're going to remove the uterus, cervix, right? And you have to do radiotherapy. Remove the uterus and the cervix followed by radiotherapy. Since it's an invasive cancer, you have to give radiotherapy, radiation therapy, right? But if it is non-invasive, are you going to send the patient back or are you going to do some other procedure? See, now the report comes as adenocarcinoma in situ from the endocervical curettage. Now, since it is going to be a non-invasive type of cancer from the cone biopsy report, are you going to allow the patient to just come and follow up? No. You have to counsel the patient regarding the risk of invasive cancer sooner or later, right? This can become an invasive kind of cancer. So because of that reason, you have to advise hysterectomy, that is removal of the uterus, the cervix in that patient. If she is going to be a reproductive age group female, you have to ask her to complete her family as early as being possible and then come for hysterectomy. So is that clear? So endocervical curettage, the report comes as adenocarcinoma in situ. So next step following this, you are going to do an cone biopsy in order to rule out any invasive cancer, right? Why based on this endocervical curettage you can't take any decision is because you're just going to cure it. You are going to take the samples from the tissue samples from the endocervix, but in order to rule out any invasive cancer that has spread beyond that part of the cervix, you have to take the sample from all the parts of the cervix. So this cone biopsy has the advantage to take the specimen from the exo, endo and the transformation zone. So by doing this, you can come to a conclusion of whether it is an invasive or a non-invasive type. If it is going to be a non-invasive type also, you have to advise hysterectomy in this patient because adenocarcinoma in situ is already present in that female. For that itself, you have to do hysterectomy, and you also have to counsel the patient regarding the risk of development of invasive cancer cervix, right, which can have the probability of metastasis as well. So you have to counsel the patient regarding the risk which overrides the benefits and perform hysterectomy in the patient. So if it is a non-invasive, just do hysterectomy. If it is an invasive, do hysterectomy followed by radiotherapy. So right, I hope I have made the discussion very fruitful, so that you might have a clear understanding about what is endocervical curettage. I hope this is very helpful for you students, and please just subscribe to this Mackler platform so that you will be getting even more interesting and yet more volatile topics in a simpler fashion, so that this might help in your NEET PG, FMJ, INSET, NORSET, or any competitive examination, as well as in your university examination as well. If you have any queries, please write to us in the Mackler Gmail handle. We will get back to you as early as possible. So in the following modules, we will discuss further things about the cervix, right? Okay, please keep studying until let's meet in another interesting session.